And now we are joined by, joining us today, somebody who's known for significant contributions to India's education sector and social development initiatives. We're joined by Mr. Mohandas Pai, co-founder and chairman of Aarin Capital. Also, I would like to call upon on stage Mr. Ravi Bhatnagar, Communications and Corporate Affairs Director, South Asia, MENARP and Africa, RECED. Ravi, welcome back. So thank you, Mr. Pai, for joining us today. You are known for your significant contribution to India's education sector and social development initiatives. Now, Viksit Bharat envisions a developed, equitable India by 2047. In your view, what should be the top priorities for integrating public health, hygiene and preventive care into a broader vision of a developed India?
Well, I think the important thing as regards public health is that public health should be expanded to make health facilities available to everybody. Now, we have got a range of health facilities, very high-tech health, private health, government health, etc. A large part of the government system is broken. We have a large part of a population who can't afford to go to private hospitals, which are available. So we have to expand government health system to make health available to everybody. That is, one, we must make primary health centers available to every community. I think that's very important, because if the community has private health, primary health available, it solves a lot of problems. Second, we must make hospitals available within a short distance to everybody all across India. That will make sure that smaller things and illnesses can be taken care of apart from primary health. Then tertiary hospitals should be available with ambulance service from primary health or from multiple villages. We need a national ambulance service to make it happen so that availability goes up. Second is you must make sure that there's 100% institutional delivery. Second is you must make sure that there is a wellness program so the regular health checks are available to everybody. And that means that primary health services should expand to give health checkups to everybody, and people can take preventive care and get any health benefits earlier. And this can be done through technology, using telemedicine and tele-advice. And then you must expand the creation of human capital. We now have about 120,000 seats for medicine and about maybe 75,000 seats for master's program. But what we need is quality health education. And that means that why don't we allow all colleges, private or public, which have been around for more than 20 years, to expand the capacity to 500. Because if we're able to do that, then I think we'll get more quality. And one other item is that drug availability of cheap, affordable drugs. I think that the system started by Prime Minister Modi to have the shops all over is very interesting, saving a lot of money. So what we need is effective management and governance of the system that you have built, and to fit in the gaps using technology and better human capital.
Mohandas, campaign Banega Swasth India is now launching season 12. It's the longest running public health campaign in India. We talk about how the government needs to work on healthcare, but initiatives like this campaign led by industry, government and civil society together accelerate both economic development and population health so that every Indian meaningfully shares in the growth of Viksit Bharat. So how important are campaigns like ours today?
I think campaigns like yours are very important to get public participation and to make people aware of health issues, because much of the disease that we have are preventable. So what needs to be done from your side is, we have about 650 medical colleges, maybe 5 lakh students. And all students in medical colleges have to study public health. Why don't you involve all these colleges and all the students in a public health campaign so that they can spend some time and become participants? And getting 5 lakh students is very, very important. And that is a very, very large pool of people.